We're going to pose to you this afternoon to think about the prevalence a little bit differently and talk about what we call the secondary impact for girls and women with autism. So we're going to talk to you about what we describe as the secondary impact from the prevalence rate, the implications for practice, and then the vision for our program that we talked about earlier. Dr. Bailey illustrated for us earlier the latest prevalence rates in Canada, which seem to match a lot of what we've been talking about during this past 2 days, and obviously we all know about that, but I think it's pretty safe to say that a lot of people, just in the general public, would say that, that recognize autism being more prevalent in males as compared to females, which one could argue then that it might have a lesser impact from a population standpoint. If you're thinking from a business model, okay, well maybe this population isn't as affected or potentially doesn't need as many resources or a less of a focus would be okay. There's also then this theory development around, well, why is that? Why are there fewer females diagnosed with autism as compared to males? And we start to talk about the female protective factor, or are we missing them, right? So regardless of why, or regardless of the actual prevalence rate, which is one of the things we've been talking about today, we see that more males having a diagnosis of autism results in about 82% of participants in published research studies being male. So then that has implications, a lot of which we've talked about in terms of the ascertainment bias, so that our tools are based on the participants that are participating in research and in the standardization of those measures, which then informs diagnosis, which then of course informs prevalence, which limits what we know about girls and women with autism and that development, that trajectory of what those symptoms or characteristics look like across time, or even an accurate representation of differences between those two groups, males and females, or how they, like I mentioned earlier, how that they might compare to girls without autism. Which then also impacts the outcomes or generalization. So making much of what we know in the research based on males, and so causing potential pause when we're going to generalize findings to females. I'm not arguing that all the evidence-based practices that have been done shouldn't be generalized to females, but I think we should be thinking about what that means and thinking about the differences that we know already between those two groups and what does that mean in terms of interventions and outcomes from the work that we've already had. So there are very few studies that publish the outcomes between those two groups to show the differences in outcomes. And I know that our study is one of a few that is just looking as a published study looking at the outcomes of a program specifically for females. But even if, when you think about the different types of intervention, whether it's early intervention or other social skills programs, people rarely publish those outcomes separately. And that has implications. One is if we look at those findings, a lot of times there's just a couple females in those samples, or justification of recruitment at that same rate as prevalence. In a lot of studies that'll be acceptable, or then the outcomes that we associate with that, like just grouping them together. So that's one factor, is thinking about, can we generalize this to this group? But also then it limits our progress as we are starting to think more about, okay, well maybe there is a difference, or maybe we should be looking at this outcome, to go back, which is called meta-analysis, and look at studies and to see even if it was a study over time on some early intervention models, and to parcel out outcomes for females as compared to males. But if researchers aren't putting those numbers in their papers that are published, then we can't go back and do that meta-analysis. So those types of things are limited by the prevalence rate, but we're not always thinking about it that way. That's something that, as part of a sex differences panel a few years ago, we talked about shifting the needle that way. That at the very least, if people were going to continue to publish or just continue to recruit a higher number of males in the research as compared to females, that at least if they put the raw data in the report, people could go back and look at that. Or you'll see I've noticed more articles lately that will say, in the title, for males with autism. So they're identifying, we had just this sample, as opposed to like lumping everyone together in the group. So I think those are moving us forward a little bit as well. So regardless of this, so fewer information about girls, fewer people who have that diagnosis and are in this work, ultimately has what we think of as a secondary impact. So that means programs are male dominated, so it also means fewer opportunities for girls to have interactions with other girls. We've been talking about fewer opportunities to make connections. And if limiting your opportunities to be around other people that you might relate to then limits your opportunities to practice those skills or engage in those interactions, that's going to make you, could result in then fewer relationships. And we've been talking a lot about this, impact on social emotional health, anxiety, depression, those kinds of things. And we're going to talk about how, the work that we've been doing and some others have been doing might inform the importance of this limited social opportunities with others and how that could impact overall social emotional health as well. I'm going to let Nicole and Abby articulate for us their experience with regard to these limited opportunities.
I try to express what I feel, I express what I'm trying to say, but the problem is, because of autism, I have this in me that constantly blocks every word I want to make out. Well, I just realized that I'm not alone, and that there's some girls that are willing to help me pull through life.
These young women are part of a trailblazing program here at the University of Kansas Medical Center, one which teaches girls with autism social skills and personal care, everything from getting dressed to exercising good hygiene. What was your world like before that?
I felt a little more alone, and I felt like an island.
So this is, even though it seems obvious, right? We hear it all the time. People are saying, oh, there's few girls in programs, or even if girls are having some learning problems in the States, sometimes individuals are pulled out and have specialized instruction through special education. There's more males in those programs as well. And so we hear from families all the time, they were the only girl in that program, or we just haven't found anything available to us where we could connect. She could connect with other girls. And so that seems obvious, but I think the implications of that are one of the things that we need to pay more attention to. Is this the same? Oh, there we go. This is Abby.
I actually go to a school with a lot of boys who have autism. I didn't have much friends, and that changed. And it feels like all of my G&O friends are like BFFs towards me. There we go.
And Abby spent part of her day at a school for kids with autism, and she was the only girl there, and then part of her day in a general kind of education school setting. And she had some interests that I would say, she should have been able to connect with other kids, boys and girls, and yet she still talked about feeling isolated and left out of those interactions, or even some of the bullying that we heard about earlier. I feel like she talked about how that was really getting in her way as well, because she was the only girl in that setting. I'm going to let Jess talk about our work and how it informs this secondary impact.